Hi, I'm Liz Kearney, Director of Nursing at the Rehabilitation Hospital of Northern Indiana, and I'm here today to talk about spinal cord injuries and pain control. First, I have to address spinal cord injuries in general. Right now, the average age of a spinal cord patient is about 43. It used to be 29, but due to improvements in car construction and safety knowledge, the age has increased. The primary cause of spinal cord injuries is still motor vehicle accidents. The secondary cause is falls, and that is with an elderly population, usually with a severe injury. About 10% of the spinal cord injuries are related to recreational activities. So when you hear about those diving accidents, things like that, that's the cause of those spinal injuries. With spinal cord injuries, you would think a patient doesn't have sensation, so they're not experiencing any pain. Unfortunately, that's not really true. You can have pain in areas with sensation and without sensation. That's because there are several different types of pain involved with a patient in spinal cord injury. You can have neuropathic pain, which is nerve related, and that's because your nerve signal from your spinal cord has been disconnected. So those nerves are receiving input from other areas. So you might feel pain in areas that you have no sensation in anymore. That doesn't mean that you're not actually experiencing pain, but your signals are mixed up. Another type of pain is musculoskeletal. That can be in your shoulders, back, arms, neck. It's really from overuse. If you have a spinal cord injury and you are a paraplegic, you may be using your arms and back to propel your wheelchair. You're transferring yourself a lot. You're getting some overuse injuries of those important joints. If you have tetraplegia, that used to be called quadriplegia, you've got a C-level injury, and you still may be ambulating and have some weakness in your back that requires some pain control exercises. The other type of pain that patients with spinal cord injuries get is visceral pain. That is abdominal pain usually, and it can also be referred pain. That means the pain signal's not following to where it should go. So you might feel like your back hurts, but it's really your stomach. It's essential that you get medical assistance if you have visceral pain, because it could be something that could cause autonomic dysreflexia, which is a condition that spinal cord patients often experience. With pain, there are some ways to manage it after spinal cord injury. It's not hopeless. It's not all in your head. There are some physical treatments. Of course, there's medication, but we try to go with a non-medication approach first. So physical therapy, stretching, muscle strengthening activities where we are able to do it. Also teaching people to change position more frequently and maybe change position in a different way, because that's also essential because it prevents pressure ulcer development. You can do therapeutic massage, which is something that a lot of occupational therapists also help with. That is to relax those muscles that may be tensing up. You can do acupuncture, which people are probably familiar with. That is available in some areas. You can also use TENS, or transcutaneous nerve stimulation, and that is putting little electrodes on the nerves where you're feeling the pain and kind of disconnecting those nerves from going to the muscles. There are psychological treatments for pain in spinal cord injury patients, and they really are essential. It's not because you have a mental illness or you're not really seriously experiencing pain. It's to teach you ways to handle the pain. There are relaxation techniques. They can teach you deep breathing, biofeedback. There's also it's called cognitive restructuring, and that involves thinking differently about your pain. What is your pain doing that's affecting your daily life, and how can you manage it? It's kind of putting you in control of your pain instead of letting your pain take over for you. There's also psychotherapy, and really, because pain does cause stress and anxiety, people need to look at that as a possibility, because the more anxiety and stress, that will lead to depression, and then that will lead to other pain issues.